Hey everybody, my name is Sharalaya and I am an interventional cardiologist, one who specializes in treating coronary artery disease and heart attacks among other cardiac conditions. And today I wanted to explain a little bit to you about two very common terms that we hear about in medicine. What is the difference between a cardiac arrest and a heart attack? So basically, a cardiac arrest occurs when there is an electrical issue that causes the heart to stop beating. And a heart attack actually occurs due to a plumbing issue, which happens because of a blocked coronary artery. There are different ways to deal with these problems, but my goal is to basically explain to you how to recognize these problems at home and what to do while you're waiting for medical attention to arrive. If a cardiac arrest occurs, there are a lot of different reasons why this could have happened to somebody. Severe blood loss, severely low oxygen levels in the bloodstream, drug overdoses. Some genetic conditions can lead to heart failure, and heart failure in and of itself can put you at higher risk for abnormal heart rhythms. Severe infections or even electrolyte disturbances can lead to a cardiac arrest. A cardiac arrest will ultimately cause somebody to become unconscious, and leading up to this, somebody might report shortness of breath, chest discomfort, severe weakness, or palpitations. So if you are in a public place or around somebody that's reporting this, or somebody passes out, your first step is to check a pulse, preferably the carotid pulse, and that's the artery right here in your neck. If you feel a pulse, then I would call 911. If you do not feel a pulse, call 911 and immediately start CPR. The most important thing to keep in mind is that the sooner you start CPR, the higher the likelihood of survival. Another important thing to keep in mind about a cardiac arrest is what kind of heart rhythm is occurring at the time. And the only way to know this is to hook them up to an automated external defibrillator, or an AED. This is something that is present in most public places. So it is an easy device to hook up, and once you turn it on, the device will analyze the patient's rhythm. Once the rhythm is analyzed, it will tell you if this heart rhythm is able to be shocked or not. There are two kinds of shockable heart rhythms, and those are ventricular fibrillation or pulseless ventricular tachycardia. These two shockable rhythms can sometimes indicate an underlying blocked artery or a heart attack taking place. So if these rhythms are occurring, then the device will tell you to administer a shock. The rhythm that is not shockable is called pulseless electrical activity, or PEA, and in that case, CPR is the best and only way to revive the patient and ultimately treating the underlying cause of PEA, or the cardiac arrest. We've talked about a cardiac arrest, so what is a heart attack? A heart attack then is more of a plumbing problem, which happens when there is plaque inside the coronary artery that has ruptured and a blood clot forms inside the coronary and blocks blood flow to the heart muscle. The longer that blood clot stays there, the more damage that is done to the heart muscle, and that can actually lead to a cardiac arrest due to abnormal heart rhythms or extensive heart damage, which can lead to heart failure or other complications. As an interventional cardiologist, we like to say that time is muscle, meaning that the longer that you wait at home with chest pain that could be due to a heart attack, the more heart muscle is dying off as a result. So even at that point, if we were to take you to the cath lab to open up that blocked artery with a stent, sometimes that heart function might not recover because too much time has gone by and a scar has already formed in the heart muscle. Please remember what the signs and symptoms are of a heart attack, and these symptoms can be very different according to gender even. So a lot of times people have chest pain, chest discomfort, jaw pain, or neck pain. This pain can even radiate to the back, shortness of breath, fatigue, and indigestion or nausea that's just not going away with your regular Tums. If you or somebody around you is experiencing these symptoms, please do not waste any time at home. Please call 911 if you don't have somebody to drive you to your local ER. After calling 911, if you have access to a baby aspirin and you do not have prior issues with bleeding, you can take a few baby aspirins while you're waiting for ambulance to arrive. As an interventional cardiologist, I have 90 minutes from the time that you hit the door in the ER to open up your blocked coronary artery. And that is the standard that we hold ourselves to be able to give you the best outcome possible in a very scary situation like a heart attack.